The question of recession is, well, isn't this normal? Isn't this what happens with aging? And the technical answer is no, it isn't. But it does happen. It normally is associated with the brushing techniques of the patient, that they actually are brushing too hard. We also are finding that with the new dentifrices, the toothpaste, that they're putting so many different products together nowadays. You've got your whiteners, you've got your anti-gingivitis, you've got your anti-tartar. They're putting all these things in, and the toothpastes are becoming a little more toxic. And if we're brushing vigorously, we can do some damage, more damage to our teeth. In the long run, you could, if you left it go long enough, you could lose a tooth. It could recede upwards. Now, thank goodness I don't see a lot, because most of the patients I see are on a recall with their dentist. But if you disappeared for 10 years and you came back, then it's possible that some of those teeth could be in trouble. Probably once or twice a year I'll have somebody, and it can be a young person that let it go so far that it's right down at the end of the root. And now it's much harder to try to save that tooth. So it's an important aspect. I also believe it's becoming even more of an important aspect in implant health. The attachment of the tissue to the tooth is stronger than the attachment of the tissue to metal or an implant. So we're finding that we're getting a little bit more food impaction with our implants. The areas are more or less like a drawstring that's holding that tissue in place, rather than fibers that are attaching to the body of the implant. Just recently, there's an implant company that's showing fiber attachment, so it's going to be interesting to watch that group and see if that's going to make a difference. But some of the problems we can have with implants is due to the improper type of tissue that's around them. So gingival grafting is becoming even more important than it probably was a while ago. There's some confusion nowadays between what we call a gingival graft and a connective tissue graft. Going back a long time, a gingival graft was a way of replacing the type of tissue which holds the gum against the tooth, and nowadays also against an implant. It's made to be stronger. The movable gum is gum that's made up of a very thin, light, elastic tissue, and it really doesn't hold the seal real well because it's pulling back and forth. So a gingival graft came about a long time ago in order to give us enough strength to prevent the tissue from pulling away from the tooth. This can be a natural tooth, it can be an implant. Connective tissue grafts is somewhat of a newer procedure in which we can take recession. You had mentioned in your own that if the appearance looks as if some of these teeth are going to be too long, we can go in and bring the gum down and bring it back to its original position with connective tissue grafting. The connective tissue is usually taken from the palate of the patient, but there are other ways of getting the tissue. There is cadaver, something called allograft that we can use. There's some synthetic type of products nowadays that are equivalent to using the patient's own connective tissue. So here's a way of actually taking areas of recession and bringing the teeth back to their normal, the gums back to their normal position. So that's a connective tissue graft. The difference is that a gingival graft usually is not used to cover the root. It's usually there to just give us a stronger band of attachment, where the connective tissue graft is primarily to come and to cover the root surface. And it's usually attached to aesthetic type of procedures.